November is National Diabetes Awareness Month, and the buzz around diabetes right now is that it's treatable and preventable. Bill Schueler is a nurse at Monarch Medical Weight Loss Center in Eugene. You've got a couple of locations across the state, right?
Between Florence, there's a few in Portland, Roseburg, Salem. Yeah.
So, as a nurse affiliated with a weight loss center, you probably see a lot of overweight diabetic clients.
Yeah, we see a few, yes.
So how much of your caseload would you say is diabetics?
Maybe between 10, 20%.
Oh, wow, wow.
Yeah.
What are the different kinds of diabetes that are out there?
There's type 1, which is you just naturally have a problem with producing enough insulin, and that's usually about 10% of diabetics.
So you think that's hereditary?
It could be hereditary, yeah.
Like
or
juvenile diabetes?
Juvenile, yes. Or you're just born that way. And then the other 90% is usually type 2 diabetes, which is you develop that over a period of time.
And some of the other concerns are obviously obesity. It's a major contributing factor to the type 2 diabetes, right?
Yes.
Okay. And then there are other issues that come along with type 2 diabetes or being overweight?
Yes.
That can affect your health?
Of course. You know, just being overweight has many, you can develop many different chronic problems from high blood pressure to increasing your risk of stroke, heart attack.
Right.
And going along with diabetes, of course, there's much more that can go wrong, from your blood vessels and your nerves to needing a lot of medical care and follow-up.
So one of the best, I think one of the best things about diabetes is we know enough about it that it can be treated and it can be prevented. Yeah. So not everyone that's overweight will get type 2 diabetes.
No.
But you can improve your health by losing weight.
Yes.
And so how would you do that?
Well, traditionally, the American diet is very high in carbohydrates, and one of the things we would suggest is cutting down on the carbohydrates and bringing up the protein, because protein affects our blood sugar a lot less than carbohydrates do. So if you bring down the carbs, increase protein, you're going to stabilize your blood sugar a lot better. And you're going to eat small, frequent meals. That's another good tip. You're going to stabilize your blood sugar very well throughout the day, versus these wild swings of blood sugar and having your pancreas and insulin having to do the work, a lot of work.
So probably a lot of people that have these issues don't even know that this is what it's connected to. It's the food that they eat. Yeah. So like take some cheese with you to work, or what do you think?
Well, pre-planning is a big step.
Yeah, I bet.
Thinking about your diet before you do it, not reacting, being proactive. Cheese is a good source of protein. Milk products, good source of protein. You've got meat, you've got deli things.
Right.
There's plenty of options as in regards to protein, and even balancing out the carbohydrates with it. One
of the things, I did a little bit of Monarch, and one of the things that I didn't even think about reading labels and those protein bars. And how much protein is actually in the protein bars that you can get at the grocery store? Yeah,
at the grocery store, it's usually a lot of calories.
Right.
It can be a lot of protein, but it can also be a lot of carbohydrates and sugars that they add in, so it tastes good.
So one of the things, we're talking about watching your diet. How is there a more specific diet for someone with diabetes than someone that's just overweight?
Well, you can use the same diet and have very good results with it. Yes. Just decreasing your carbohydrates, increasing your protein. Worry about the fat a little bit, but yes, it can help with diabetes tremendously. Plus, being overweight, of course, it helps with that too.
And then it addresses the other problems that you were talking about too, heart disease.
Yeah, decreasing your risk of heart disease, stroke. Amputations, especially if you're a type 2 diabetic.
Right. And kidney disease
too?
Is that what I read too?
Yeah. It affects the small blood vessels, diabetes does, and small blood vessels all over the place.
Right.
So, it can affect your liver, can affect your kidneys, of course your heart, your limbs, the small blood vessels in your extremities.
Yeah, that's why the amputation thing is a big concern.
Yeah.
Okay, so if you'd like more information, you can go to the diabetes.org website, or you can go to the monarchmedical.net website, or it's all linked to KVAL.com. Thanks so much for coming in, Bill.
Thank you.
We'll be right back.